Hello. Today we're going to practice doing bed mobility with a patient who is dependent. And I want to add first that this is typically something you'd like to do with someone else, but we're going to teach it as if you're going to do it on your own. And so the first thing that I like to do when I see our patient for the first time, if there are any safety hazards or any types of other feasibility concerns that we need to take into account. And so I'm going to look at the bed, make sure it's free of clutter and other items, and then I'm just going to look around the bed and make sure it's all safe for me when I'm doing the mobility. And now that I see it's safe, I can go and we'll have a little conversation. I'm paying attention to her orientation and alertness, so the time, place, self, and situation. Hi Laura, how are you doing today?
I'm great. How are you?
I'm good. I was wondering if it would be okay if we could get to the edge of the bed and sit up. Is that okay with you?
That'd be great.
Okay. So now that we've kind of had our little interaction and she's okay with us moving, I'm going to get a pain assessment and then we'll begin. So how is your pain doing today?
No pain today, sir.
No pain? All right, let's begin.
The therapist will ask the patient to bend her knees up with the feet flat on the bed. If patient is unable, the therapist will bend the knees and place the feet on the bed. If the patient is unable to move her arms, perhaps if she has hemiplegia, it is important to protect her shoulders from impingement by crossing the arms over the body where they will be comfortable and safe. However, this patient has the ability to move her arms. She will extend out her left arm and use her right arm to reach out and clap to help facilitate rolling. The therapist is now going to roll the patient. Body mechanics will be especially important for safety. The therapist should check and make sure that he has a wide base of support and is close to the patient, and try to do all the movements for a flat back and avoid twisting. Now that we're ready to move, the therapist will keep the left hand behind the knees with the right hand around the lower portion of the back and instruct the patient to try and roll to the left. With the patient's assistance, the therapist will roll the patient to the left, making sure to keep his body close to the patient for safety and to ensure proper body mechanics. With the patient on her side near the edge of the bed, we're ready to try and sit up. The therapist will bend closer to the patient while guiding the patient's leg off the bed. Once the legs are off the bed, the therapist will bring his right arm and cradle the patient behind her head and shoulders. With firm pressure, the therapist will press his left hand into the pelvis while guiding the patient's trunk into a seated position. Once the patient is in a seated position at the edge of the bed, the therapist will maintain close proximity to the patient to ensure safety and provide comfort.